can you tell us some of the effects that vaping and like the nicotine have on the body, the brain?
Okay. Well, as we just mentioned, inhaling foreign substances into the lungs, besides the air we need to sustain life, in significant amounts is unhealthy and can cause damage to lung tissue. So why do people smoke? Nicotine is a stimulant. It activates neuronal receptors in your brain. It makes you feel stimulated. It gives you a fast heart rate, can cause a rise in blood pressure, feeling flushed and more energetic. But let's see, nicotine also affects dopamine receptors in the brain associated with pleasure or reward. That's why it's highly addicting. Moreover, the adolescent brain is still developing. It doesn't finish completely developing until your mid to late 20s. So there's still a lot of plasticity there. Therefore, if one begins smoking earlier in life as an adolescent, the potential for addiction is higher, and it's also a lot harder to quit if you start smoking earlier in your teen years while your brain is still developing. We also know that nicotine can have detrimental impacts on the brain development in youth. It lowers impulse control circuits, alerts circuits related to mood and addiction, and affects brain regions dedicated to attention and learning. So smoking and e-cigarettes, which is another way to get the nicotine, has more adverse effects or neurotoxicity on the developing adolescent brain than in older adults. But we still don't recommend it for older adults either, obviously, because it leads to lung disease, chronic obstructive pulmonary disease, emphysema, and it's just implicated in a whole bunch of adverse risk factors: cancer, heart disease, stroke, you name it. Smoking is just not good for you. In teenagers, using e-cigarettes is associated with eventual 3 to 6-fold greater odds of eventual cigarette smoking and marijuana use anyway. So it's not a good alternative because it increases your risk of eventually moving on to regular cigarettes or even abusing marijuana. We know nicotine itself is teratogenic. That means it causes birth defects in unborn babies or pregnant women, and also it is associated with preterm birth and low birth weight. So we know it's bad for pregnant women, and we know it's bad for their babies. Yeah, it's also bad for the people who are smoking it. It's just not a good drug all around. Now, some of them, I'm not judging people who smoke. Some of the most functional people I know smoke because it, like I said, it helps with energy and attention. But when I'm talking to adults who smoke and counseling them to quit, in the office, we weigh the risks and benefits, the benefits versus smoking versus adverse effects. And for most people, the risks don't outweigh the benefits.